So, hello everyone. So today we're going to study about urinary symptoms and investigation from the book called Billy and Love Short Practice of Surgery, 27 edition. And, let's go. And there is you can see on the lower right corner there is this 45 minutes timer given. And today we are going to start study in a Pomodoro technique. So, so we'll be having 45 minutes session of a Pomodoro, and we'll have a long break of about 20 minutes and short break of about 10 minutes. So let's go. Let's start the timer, and then I'll start to study. So our timer has started. Now we're going to study the urinary symptoms and investigations. Okay. So I guess I've already studied this topic before, but I need to revise it again. So I'm going to study it again. So pain. Pain is a common urological symptom and can be due to the pathology in any component of the part of the urinary tract. Pain passing urine is called dysuria. Okay, dysuria. If there's pain in passing urine and refers to the discomfort of localized outlet of the bladder which is experienced during the voiding. And refers to discomfort localized to the outlet of the bladder which is experienced during the voiding, typically described as sensation akin to passing razor blades or glass. Okay. The patient suffering from dysuria often says that while passing urine they feel like passing of a razor blade or glasses through the ureter. So dysuria is that kind of pain. Most commonly, dysuria is due to the infection in the lower urinary tract infection. Okay, the lower urinary tract, but can be symptoms of more serious pathology such as bladder cancer or carcinoma in situ. Okay, so bladder cancer and carcinoma in situ are the other causes of the dysuria or painful micturations, and this is most common in older male, especially the older man who smokes and present with hematuria. So this is the new thing that I learned. CSIS, I mean carcinoma in situ, and bladder cancer. So dysuria is also seen in case of bladder cancer and carcinoma in situ. However, it is more common in case of lower urinary tract infections. Mm. So now let's talk about so we talked about dysuria. Let's talk about the renal pain. Okay, renal pain is usually caused by distance of the renal capsule and is felt at a constant growing pain in the low and renal angle. Okay, renal angle. Okay, so renal pain is so we just need to know that renal angle is of doll type and mainly feel in the renal angle. Now you might be confused what is renal angle, and I can recall the renal angle. Basically, the renal angle is actually a point in between two wall lower wall of the two wall rib, let's suppose, and the erector spinae muscle. So let's suppose this is a two wall rib and this is erector spinae muscle. So right here is the renal angle, and in case of renal pain, this angle, okay, this point actually pains a lot. So now let's talk about the uteric colic, often incorrectly referred to as a renal colic. It's different from renal pain and is typified by the lateralized colicky pain experienced by someone who has uteric calculus. Okay, so colicky pain is obviously different from the renal pain, and it is lateralized. Okay, probably which it means it is more lateral. The pain is colicky, obviously experienced by someone who has uteric calculus. Okay, uteric colic can radiate to the groin or lower still to the testiculum or labium. So testicle in case of male and labium in case of female, but does not radiate to the back of the leg. Okay, this point is important probably, but I don't know why. So uteric colic can be caused by something other than stone in the ureter, such as blood clot or rarely a slough of renal papillae. Okay, uteric colic can be caused by something other than stone in the uterus, such as blood clot. Okay, blood clot. Okay, if there's any blood clot in the ureter, it might cause colicky pain, and rarely sloughed renal papillae. If there's any sloughing of a renal papillae, it might cause colic pain as well. If the history is carefully taken, it will be apparent that some patients simultaneously experience both urinary colic and renal pain. Okay, so this sentence means that there are some people who experience both renal pain as well as urinary colic. Okay, and we can identify it with the help of the history. Disease processes in the bladder example. Okay, the disease processes in the bladder example, infection of the infection or inflammation can produce suprapubic pain. Okay, there might be a suprapubic. So we talk about renal pain, dysuria, renal pain, urinary colic, and now the suprapubic pain. And it might suprapubic bladder pain, which is experienced when the bladder is full and is relieved by micturition, is typical of interstitial cystitis, which is an infection of a bladder. When bladder is full, okay, whenever the bladder is full and there is pain, so okay, it is interstitial cystitis and idiopathic benign inflammatory disorder of the bladder, typically seen in the middle-aged females. Testicular pain is a common symptom in men, especially in early middle-aged. Testicular pain is common symptoms in men, obviously, especially in the early middle-aged. Sudden severe testicular pain in younger men, okay, less than 40 years old, should be treated as a medical emergency, and the patient assessed so that the diagnosis of the acute testicular torsion can be excluded. So testicular pain is one of the most important cause if the patient is having lower pain in about flank region. So testicular pain should be excluded as well. So it is a common symptom in men, especially in early middle aged. Sudden severe testicular pain in younger men should be treated as a medical emergency, and the patient assessed so that the diagnosis of acute testicular torsion can be excluded. Acute testicular torsion can be excluded. Okay. Testicular torsion generally comes in emergency. The time interval from the onset of the pain to the diagnosis of a suspected testicular torsion should not be influenced whether scrotal exploration is performed as torsion. Detorsion may be occurring and the disease may still be salvageable. After a delayed time interval, hydrocele and epididymal cyst usually do not cause significant pain. Okay, hydrocele doesn't cause significant pain. Epididymal cyst usually do not cause significant pain, okay, but can have an increasing pressure effect as they enlarge. A dragging sensation of the in the scrotum, which gets worse towards the end of the day, is typical of the discomfort associated with the varicocele. Varicocele often on the left side. Typical testicular tumors in young males are not associated with significant pain. Investigation of testicular pain in a young male is frequently negative, resulting in highly unsatisfactory diagnostic level of idiopathic testicular pain, which is subsequently managed with the input of the other clinicians, most commonly pain management specialists. Patient undergoes vasectomy are routine counsel of the approximate 10% risk of the testicular pain in the short term following surgery, but more importantly, the 1% chance of chronic testicular pain in the long term. Okay. Perineal pain is often a feature of a complex symptoms typically seen in middle-aged men who by a process of exclusion are diagnosed as suffering from acute or chronic prostatitis. Okay, I'm getting it. Perineal pain is often a feature of complex symptoms seen in middle-aged men who by a process of exclusion are diagnosed as suffering from acute or chronic prostatitis. Okay. In case of prostatitis, there is perineal pain. In case of cystitis, there is pelvic pain, and there is renal pain and urinary colic and dysuria. So we need to understand those things. So pain from the urinary tract. Okay, renal pain is synonymous with renal colic. Renal colic in Swedish numbers would be referred to as a urinary colic. Obviously, renal pain can be distinguished from the urinary colic by careful history taking. Obviously, renal pain and urinary colic may be experienced simultaneously. Urinary colic may relate to the groin testicle and labium. Okay, not to the back of the leg. I don't know why it is said, but it is written right here that it doesn't relate to the back of the leg. Okay, it might be a symptom of some other disease that we need to exclude. And the urinary colic does not radiate to the chest or back of the leg. Yeah, exactly. Why? With prostatitis, perineal pain may be accompanied by suprapubic. Okay. I hope you guys are having my voice. I mean, hearing my voice, and I hope it is clear. Okay, no viewers are watching this video, which is kind of good and bad at the same time. So if you're watching this live video, then please let me know. Please comment. Okay, no, I am not alone. Okay, so we have 35 Pomodoro. Okay, 30. So we're starting just it is just 30 minutes. So I'm going to. Okay, let's so low urine tract symptoms, LUTS. Okay, the International Continence Society provides the international accepted symptoms related to low urine tract infections, and these are important terms that one must understand. So let's talk about the frequencies. Frequency is a complaint by the patient who consider he or she voids too often during the day. The patient may report need to void more frequently than in their usual habit or more frequently than the consider is socially acceptable. So how can you know if the frequency is increased? By comparing it with the previous episodes, or the people can, or you can compare it with the other persons. Same, yes. No, let's talk to nocturia. Is a complaint that individual needs to wake up night or at least wants to void, obviously. Stangury, now this is important. Is a sensation of constantly needing to void. Okay, sensation of constantly needing to the void is stangury. Stangury. Okay, typically the patient describes having to sit for a long period with the sensation that mixture is imminent. Stangury is most common due to lower urine tract infections, obviously. So stangury is basically a feeling of incomplete void. Urgency is sudden compelling desire to pass urine, which is difficult to defer. Okay, or the incontinence means is an involuntary. Okay, or the incontinence means involuntary urine leakage. Incontinence is basically inability to control the urine, so passing out the urine. So all the incontinence is involuntary urine leakage, often large volume, immediately preceded by sensation of urgency. Okay. So if the urgency comes and after that the incontinence occurs, it is called urge incontinence. Is involuntary urine leakage, often large volume, immediately preceded by sensation of urgency. Urgency and episode of urge incontinence are often associated with an overactive bladder or a bladder neuropathy. Okay. Stress incontinence is an involuntary urinary leakage which occurs when the intra-abdominal pressure rises. This is most common in females who have vaginal deliveries. Okay, stress incontinence is especially seen in case of pregnant women due to increasing intra-abdominal pressure. At that particular point of time, intra-abdominal pressure rises, especially in case of pregnancy. Okay, so what are the other conditions in which intra-abdominal pressure rises that might lead to stress incontinence? It might be seen in case of ascites. Obviously, the okay. It is not given here, but I'm just guessing. It might be one of the causes for the stress incontinence. Okay, so let's talk about nocturnal enuresis. Is an involuntary loss of urine during the sleep. Okay, nocturnal enuresis, nocturia and nocturnal enuresis, different thing. Nocturia. So what is the difference between nocturia and nocturnal enuresis? The basic difference is that nocturia is just a sensation to need just a so let's talk about nocturnal enuresis. In case of nocturnal enuresis, there is passing of a urine in a bed without a knowing. However, in case of nocturia, it is just there is just a desire to masturbate in the night. Hesitancy is a term used when the individual describes difficulty in initiating the micturition. Okay, so it is seen in case of benign prostatic hypertrophy, I guess. Resulting in the delay in the onset of the wedding of the individual is ready person. So in case of benign prostatic hypertrophy, there is both hesitancy and strangury. Okay, I don't know how to pronounce this term. I'm trying my best. So reduced urine stream is usually reported compared with previous performance or in comparison with the performance of the other. This is often symptoms of bladder inlet obstructions. Reduced urine stream, okay, is usually reported compared with the previous performance. Okay, so urine stream reduction of urine stream is also performed in case of previous habit or the person of the same age, or the other thing was a frequency. Okay, we don't know the frequency of the person. If it increase or decrease, we only know that by comparing with the previous habits or the person or the person or any other person. So similar in case of reduced urinary stream, which is usually compared with the previous performance or in comparison with the performance of other. This is often seen as bladder outlet obstruction. Okay. So in case of bladder outlet obstruction, there is a reduced urinary stream. Intermittency is the term used when the individual describes urine flow which stops and starts. One or more occasions during menstruation. Stops and starts. Intermittency is when the individual. Okay, straining. Straining is also effort used in order to initiate and maintain or improve the urinary system. So straining is difficult in. So straining is also seen in case of benign prostatic hypertrophy, and actually the straining actually increases the intra-abdominal pressure. It is also one of the important causes that causes. It is also one of the important causes that causes hernia. Straining might cause hernia. For an instance, in case of older people who are suffering from the benign prostatic hypertrophy, they have difficulty in initiating the urine. Therefore, the person strains, and straining actually increases the intra-abdominal pressure. And similar in case of and in case of that patient who have weaker walls, weaker abdominal walls, the hernia will proliferate uh, out of the muscle, and it will be visible outside. So straining can result to the hernia as well. So incomplete emptying is the sensation that incomplete emptying is the sensation that at the end of the menstruation bladder fullness persists. Post menstruational dribble. Okay, is a term used when the individual dribbles the involuntary loss of urine immediately after she has finished passing urine. Okay, this is commonly symptoms of aging when the bulbar urethra fills empty completion of nutrition. Okay, PMD is symptoms which. So again, what was PMD? PMD is post-menstruational dribble, seen in case of old people as well, especially in case of the person who are more prone to the BPS, I guess, in this case as well. So it is more common PMD, which means post-menstruational dribbling, is common in case of old age as well. Should know the sound. In general terms, lower urine tract systems infections are classified as either storage, lots, frequency, okay, this is important. I think I need to highlight this term. So in general, lower urine tract okay. Hello, there's a problem. Oh shit, man. There was a problem connecting. I don't know what problem was it. Okay. My internet is good. Just 20 minutes. Okay. So lower urine tract infection. There's a storage lower urine tract infection or avoiding lower urine tract infections. Okay, or post-menstruational lower urine tract infections. Storage lower urine tract infections result from the failure of the bladder to act as functional reservoir for urine. Okay, and are more commonly seen in patients with overactive bladder or bladder neuropathy. Okay. So storage low infection urine tract infection is inability of a urinary system to store the urine, and the storage of the urinary system is basically the work of the urinary bladder. If the urinary bladder fails to store the urine, then urine due to the infection, it is called as lower urinary tract infections of a storage type. So also in case this okay. Obviously, it is so low so storage low urinary tract infection is seen in case of infections, but it is common in case of neuropathy, bladder neuropathy, or overactive bladder. Voiding and post-micturational voiding. Voiding lots meaning irritation. Increase in void. What does void? This is something like storage low urinary tract infection. There is some another thing is called voiding low urinary tract infection, commonly seen in males with the bladder outer obstructions. Okay, if there is an obstruction, there is okay bladder outer obstruction. However, male with the bladder outwards may also have storage low urinary tract infection as a thickened distributional muscle resulting from the obstruction becomes overactive, resulting in combination of symptoms. The term prostatism is now obsolete. Lower urinary tract infections are frequently investigated with the urodynamics. Okay, so let's read the summary, and I think the summary thing is only important. Lower urinary tract symptoms, okay, are classified as storage, voiding, and post-mixed. Very important. And these are important terms. Storage, voiding, or post-mixturational. Storage, lower urinary tract infection frequency. In the frequency increase means a person goes more often nocturia, meaning they. Okay. Sorry. Oh my god. Sorry. I hope no one is watching. This is exactly happening. No one is watching. I don't care if anyone watches this or not. So storage low urinary tract typical of an overactive bladder, voiding low. Okay, there's something as storage low urinary tract infection. There's something as voiding a lower urinary tract infection, and there's something as post. So voiding lower urinary tract infection is also called as a post-micturational lower urinary tract infection, I guess. Okay. Okay, no. The storage, voiding, or post-micturational. There are three types. The number one is storage, now it is voiding, or now it is post-micturational. So what happens in case of lower urinary tract infections, storage type lower urinary tract infections? Symptoms, not infections, symptoms. Damn symptoms. It was never infections. I was wrong. I was assuming wrong. So in case of lower urinary tract symptoms, there is increase in frequency, and remember the story is associated with the urinary bladder. There is increase in frequency, there is increase in nocturia, there is increase in urgency, and urge incontinence. So what is urge incontinence? Indicates often large volume immediately perceived with a sensation of urgency. Okay. At first the urge come, and there is passing of abnormal urine. In case of urge incontinence, let's look at the stories. There is increase in frequency, there is increase in nocturia, there is increase in urgency, and there is increase in urge incontinence. So urge incontinence, urgency, nocturia, and frequency. Frequency, nocturia, urge incontinence, and urgency. Urge incontinence, urgency, nocturia, and frequency. Now frequency and nocturia are basically the same thing. Let's suppose a patient goes to the toilet more often in days, and with respect to that, we could assume that the person would have their bladder movement more at night time as well. So there will obviously be nocturia. Now in case of urgency, so urgency and urge incontinence are basically the same thing. Urge incontinence is basically a term given to the incontinence in which at first there is urge for micturition, and after that the patient doesn't feel that they have passed urine. So let's move on to the next point, which is storage lower urinary tract infections. Okay, storage low impact infections are typical of an overactive bladder. Okay, overactive bladder and avoiding are hesitancy, reduced steam and straining. So what happens in voiding lower urine tract infection? Basically, the voiding lower urine tract symptoms are most common in case of blocking of the head of the bladder, which is more commonly seen in case of there is increase in hesitancy, there is reduced stream and straining. Voiding lower urine tracts are typically of bladder obstructions. Some patients may have storage or avoiding low urine tract symptoms in combinations. So what happens in this avoiding and this hesitancy increases. So hesitancy is basically in the maturation. Okay, reduce stream and straining, which is all the term given to the BPS. Okay, avoiding. So in case of voiding LUTS, there is bladder outlet obstructions, and the only cause that causes bladder outlet obstruction is prostate enlargement, because prostate is just situated at the tip of the bladder outlet. Yeah, at the end of the bladder outlet, the prostate is situated. So if the prostate gets enlarged, there is obviously be increasing. This is obviously is increase in hesitancy. There is a reduction stream and there is straining. So voiding nodes are typical of bladder outlet obstruction. Obviously, we have studied that. Some patients may have storage and voiding in combination. Okay, obviously there might be chances and are often investigated with urodynamics. Okay, so lower urine tract symptoms are often identified by urodynamics. Now let's talk about the hematuria. Hematuria is basically means the blood in urine is called hematuria. Basically, hematuria occurs when there is a blood in urine. Obviously, there is no visible hematuria. Okay, the hematuria can be divided into two types: visible hematuria and the non-visible hematuria. Older terminology referred to as microscopic hematuria and microscopic. Okay, there was microscopic and microscopic used in previously, but nowadays there is the term used is basically visible and non-visible hematuria. Inquiries should be made about the timing of the blood in relation to the urine stream. Okay, initial throughout the stream. Okay, we can identify the pain is from where. So identify the type of disease by knowing when the blood comes in the urine, at what point of time during the maturation the blood comes in the urine. For an instance, okay, initial hematuria is seen in case of urethral pathology. Okay, it is any pathology in urethra. There is initial. Further stream is seen in case of bladder and upper tracts. Okay, or terminal. Okay, terminal in seen in case of bladder, neck, or prostatic pathology. What does terminal means? It means it probably means that at starting there is no hematuria, at the mid there is hematuria, and at last there is no hematuria. So it is specifically seen in case of bladder, neck, or prostatic pathology. The hematuria in bladder, neck, carcinoma of bladder, neck, or prostatic pathology, there is intermittent hematuria, and throughout continuous hematuria is a specific feature of a pathology of a urinary bladder. And at the initial hematuria at the initially is actually more common in case of this. Patients with the hematuria should be investigated regardless of whether they are taking anticoagulant therapy. The concern for the urologist is the hematuria, especially if painless is due to I didn't get this. For the urologist, that hematuria, especially if painless is due to underlying neoplasm of the infect, usually bladder or renal. If the bladder and renal tumors can cause hematuria. Further, the hematuria includes trauma, infections and neoplasm. So this is the other teams you should understand this from today's class. You all should understand this. TIN is the cause of hematuria, and the T represents the trauma, I represents the infection, and N represents the neoplasm. Neoplasm specific to the renal or the urethra as well. Hematuria is low in pain. Okay, hematuria is basically low in pain and palpable low in mass deafness. Palpable low in mass defines the classic triaxial signs of a renal tumor. Although this triad is seen less in 10% of the patient presenting with a renal tumor. So one of the most common, one of the classic feature of a renal tumor, which is among the 10% of the cases of the renal tumor, is the presence of hematuria, there is presence of mass in flank region, and there is presence of what was that? Low in pain, palpable and low in mass defined. Yes, those were only two things. Hematuria and low in pain. Okay, this okay. So there is low in pain. There is hematuria, and plus this at first number one there is low in pain. Number two there is hematuria, and so it would be one of the most important cause of a renal tumor. Which is seen in 13% of the patient. Apart from young females with a proven urine tract infections, most patients with hematuria, whether visible or non-visible. Okay, sorry, I need to highlight this freaking point. It's not this 10 thing is very important. I would highlight this point. Okay, apart from young females with proven diagnosis, most patients with hematuria, whether visible or non-visible, will be investigated urgently at a hematuria clinic where they have renal ultrasound scans and cystoscopy, flexible cystoscopy as a minimum. The cancer detection rate depends on the degree of hematuria, being approximately 20% in the person with a visual hematuria, very much less in the person with non-visual hematuria. So hematuria nowadays, so let's look at the summary box 75.3. So there is hematuria. Nowadays it is classified as visible. Okay, nowadays it is classified as visible and non-visible hematuria. Previously used to classified as microscopic and microscopic. So the T thing is very important. T represents for the trauma, I represents for the infections, and N represents for the neoplasm. Neoplasm specifically renal pelvic. Okay, there was a thing that this person is eating. Oh shit. This is a problem. My battery is not working that well. Okay, discussing the urine, mood of first of having you have now discussing urine, what's gonna happen? Okay, there's something else, with this one how the presence of human urine for other part of the discussion that positive test, okay, positive dipstick. So dipstick test is an important test that is used to perform in case of urine in order to understand if the patient is suffering from hematuria or not. Reading discussion is hemoglobinuria into AB. Hemoglobinuria means okay, the experience of urine is it present hemolytic disorders, okay, such as march hematuria, clinical in dehydration after the prolonged marching. Likewise, myoglobinuria, okay, after the patient marches prolonged, there might be seen of hematuria or disclosing urine or chloride. So Red might be mainly due to hemoglobinuria, classification. Okay, and classification dehydration after protein matching. Okay, likewise, myoglobinuria is hemoglobinuria. Myoglobinuria is a monocyte destruction. It is destruction of monocytes. There is myoglobinuria. It causes rhabdomyolysis after causing injuries. Can also be very discussed in urine disorder and production. 4 or 5, yeah. Severe medication can cause red or orange discoloration. Most commonly with pumping. Okay, phenazopyridine. Repumping isoniazid or repumping isoniazid or phenazopyridine with tears. But it is other repumping and the containing from flooding. Consumption large quantities of beetroot can cause discussion using this due to betaline. Now beta shannon or betaline, you need to understand this topic. And into some beetroot, okay, and pigments of betaline. Okay, there is one commonly used antibiotic nitrofurantoin and metronidazole can lead to urine being discolored brown. Brown urine is due to high circulation bilirubin, also physical obstructive jaundice. And metronidazole can lead to the urine being discolored brown. Yeah, there are some other terms that we could read today. The number one is hematospermia. It is a blood which can be battered or brown color seen in semen. It is most commonly due to benign inflammatory change in prostate, but occasionally it can be resulting prostate cancer. In process, the hematospermia. A digital examination should be performed alongside the prostate specified antigen. Okay. Transductor US should be considered in most cases. Okay. Pneumaturia means air in. Okay. Bubbles using flames using only stops in the common cause online colovesical fistula. I knew this term, colovesical fistula. Syndrome. Okay. Young females symptoms which have been documentation are reported but with a negative bacterial. Sometimes we require simple fistula of the application. Symptoms related to external genitalia. Okay, this is important. Are they important? Disease may be absent from the scrotum in patients with the undescended or ectoplastic in which less than 5 years are common cause testicular pain and swelling in the total hydrated or morgani. Often in this young males, the scrotal skin is transparent enough to allow visualization of a small bluish swelling at the superior pole of the testis. In young males suspected having testicular torsion, examination of the normal, that is contralateral testis, may be revealed or horizontal lie or clapper-bell testis. Clapper-bell testis. Okay, I don't know what is clapper-bell testis. Epidemic, particularly is rare in prepubertal male, in sexually active male, and acute epididymis, infection of epididymis. Okay, often due to chlamydia. So epididymis infection is made to counter the chlamydia infections. Okay, I didn't know that chlamydia infection can be transmitted to the sexual pathway. Let's go to now. If there's any DOPT, scrotal expression is on. Okay, at first, if there's epididymitis, often due to so we need to understand that it is caused by